The Urban Primary Health Center in Loomkyrwiang conducted an orientation program yesterday for the members of the Mahila Arogya Samiti, which is a group of women dedicated to raising awareness in the community about improving health and addressing health-related issues. The primary objective of the orientation program was to foster a closer working relationship and understanding between the staff of the health center, ASHA, and members of the Mahila Arogya Samiti in various villages. On the same day, a special outreach health camp was organized by UPHC Loomkyrwiang at the Darbar Shnong Community Hall.
Gets its birth dose in the hospital wherever it is born, the child is born, then it has to come at 6 weeks, 10 weeks, 14 weeks and at 9 months to get its immunization to be fully immunized. After that, the child has to come between 16 to 24 months for complete immunization, then at 5 to 6 years and then at 10 and at 16 years when the person becomes an adolescent. So it is very important for us to make the community understand that if we will not immunize our children, we will lose precious lives only because we didn't go and we didn't get the vaccination.
Meghalaya Chief